Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we get to talk about Lyme disease. And I get to see if we can do things or find ways to help you improve your care, or at least get some greater understanding of what's going on with your health due to this illness. The way these webinars work, you create them. You create them every week that we have them, and you create them with your questions. And I'll try to answer those questions as best as I can, but sometimes you all stump me, and that's okay. Sometimes you actually raise issues that I hadn't thought about before, and sometimes you raise ideas that help me to learn some things too. So there's no question that you should not ask. In fact, if you have a question, ask it. So tonight, I am doing a recording of the webinar, and tomorrow morning, somewhere around 6:30 a.m. Seattle time, that's Pacific Standard Time, I will be sending an email to you indicating that recording is ready. Also, in that email tomorrow morning, you'll be able to sign up for the next webinar. Now, I know that there are some people here that are attending from Europe, and as many of you know, there's some new privacy laws that went into effect. My webinar platform is being updated to allow for people from the EU to actually sign up. So for some of you, I've actually had to send you a separate link to get in tonight. But I want to let you know, to my European viewers and those that might view this in a recorded version, probably by the series of webinars that we do in July, or that I do in July, that I'll have the sign-up process fixed so that you'll be able to sign in if you are from the European Union as well too. So sorry about that inconvenience. If you do happen to need the link, just email me separately. My email address is docmarty, which is DOCMARTY and it's my practice name, which is called the Healing Arts Partnership.net. So the way these webinars work, again, you create them with your questions. Over here on the bottom, on the right-hand side of the screen, is a chat box that you can write your question to me. And I only ask that as you write the question that you try not to hit the enter key until you're completely done. When you hit the enter key, it actually sends a separate question to me. And from my side of the webinar, where I try to read a whole question and present it to you on the computer screen, you'll see in a minute, that it makes it a little bit harder to follow. So I ask that you only try to ask only one question at a time. All right? I'm sorry that you don't hit multiple enters because it creates too many questions for me. All right. So without any further ado, I'm going to go ahead and get started here. I do post the questions on your screen so that you can see them, but I also read them because sometimes in the recorded version, it's a little bit difficult to actually read those questions. So I'm going to read them out loud as well too. All right. So this first one is from SJ. Hi, SJ. Let's see. After long remission, Lyme symptoms reappeared the day I petted a stranger's dog on a walk in Northern Virginia in the city. I felt sore throat plus headache about 7 hours after the dog incident. It was downhill from there with migrating joint muscle nerve pain, nausea, chills, intense fatigue, pain in occiput area. Is it possible to catch Lyme and or co-infections from dogs? Doctors won't prescribe doxy unless I get $1,000 worth of blood tests. Too expensive. Why is this such a pain to get antibiotics? So dogs sometimes carry ticks, as many of you know. And sometimes we find ticks embedded on our dogs. Sometimes you can find ticks crawling through your dog's hair. All right. So if the dog happened to have had a tick on it and that tick bit you, yeah, I mean, it's possible you could have gotten it. The issue is I don't know that you would have gotten symptoms within 7 hours of having that. So that would be a little bit quick for symptoms of Lyme to suddenly reemerge from having had a tick bite. Now, could you coincidentally have had Lyme that got active somehow 7 hours after you petted a dog? Yeah, I mean, it may be a separate event that has nothing to do with the dog, all right? So your providers are trying to be careful to make sure they're treating the right illness because you're not remembering that there was actually a tick bite. And so they're wanting to get testing for that reason. Given the story that you just said, I probably would want to be cautious and actually get some Lyme testing done too, to make sure that I'm treating the right illness. So I can't say that's necessarily wrong, There are times, though, and I would need to ask you a lot more questions to figure out if I would do this. There are sometimes that I will actually give antibiotics, though, while I am waiting for those test results to come back. So that's just my standard in my practice, okay? All right. Good luck to you, SJ, and I hope you get some help with what's happening with you. Hello, Thomas. Let's see. Good evening, Dr. Ross. Good evening to you. Let's see. I hope you are doing well. I was wondering if you could speak to the importance of binders and which you prefer when using antimicrobial or antifungal to help with die-off. Also, what are some natural ways to increase bowel motility? Thank you for all your help. All right. So, generally, in terms of, well, let me try to think of how to address this. So I usually do not use binders in my practice to manage Herxheimer die-off reactions. I know some of my colleagues do, but I don't. I do use binders, though, when I think that there might be mold toxicity illnesses or a buildup of mold toxins that somebody may have acquired in the environment and they're not able to get rid of those mold toxins, okay? All right, so let's talk about what a Herxheimer reaction is first, and to kind of explain why I might not necessarily use binders in that kind of a situation, all right? So what happens when you have a Herxheimer reaction, the immune system sees you're on antibiotics, you're on herbal antibiotics, you're on prescription antibiotics, and they're killing Lyme germs, okay? And what happens is the immune system sees those dead bug parts and sees some of the toxins in the bloodstream that get released from those dead bug parts and reacts by making a group of inflammation chemicals called cytokines. And if many of you have listened to my webinars over time, I talk about cytokines a lot. In fact, it's fair to say that Lyme disease symptoms are actually symptoms of too many cytokines. So let me talk about what cytokines are first. So cytokines are chemicals that are made by white blood cells when they see an infection or they see a toxin. And those infections can be virus infections, they can be bacteria, Lyme infections, they can be mold or fungus infections. They can be all of those range of infections, okay? And cytokines are good and bad. On the good side, they cause more white blood cells to be made, they help draw those white blood cells to where the infection is, and they help those white blood cells work better. That's good, all right? However, in certain conditions, like in chronic yeast overgrowth in the intestines, or like in chronic Lyme disease, or in mold toxicity illness, where about 25% of people can't remove mold toxins through their liver. In those kind of situations, the immune system keeps trying harder and harder, and eventually it makes too many cytokines, all right? And it's too many cytokines that give you the symptoms that we call Lyme disease, all right? So Lyme disease symptoms are actually symptoms of too many cytokines. And those symptoms, cytokines give you difficulty thinking, make you hurt all over. They can give you fatigue. They give you brain fog. They can interfere with how your hormonal systems work. They disturb your sleep centers, all right? So those are all Lyme disease symptoms, but they're really symptoms of too many cytokines, okay? So for instance, sometimes when people have mold toxicity illness, it'll be the same symptoms because it's triggering cytokine excess, all right? All right, so when you have a Herxheimer reaction, then the thing that you want to do to deal with it is decrease cytokines. And so the way that I like to do that is I like to work with things that actually decrease white blood cell production of cytokines. And one of my favorite things to use is to use an herb called curcumin. Curcumin is a component of the Indian seasoning turmeric, okay? And it literally gets inside white blood cells and limits their production of cytokines. The second thing I like to do if somebody is having a hard time with Herxheimer reactions is to put them on glutathione. So glutathione is a master antioxidant that is made in every one of the cells in the body. It's made to fix cell damage, and it's made in very high concentrations in the liver, because in the liver it's also used to detox, okay? All right. So what happens when you use glutathione, though, in terms of helping cytokines, there's two benefits you get from it. Number one, it's a very powerful antioxidant, and it lowers oxidizing agents that tell white blood cells to make cytokines, all right? So curcumin, as I talked about earlier, gets inside the white blood cells and blocks the cytokine production. What glutathione does is it stands outside the white blood cells and blocks the oxidizing agents from telling the white blood cells to make cytokines. So you get a benefit in two different ways of actually blocking your cytokines, okay? And the other thing that's helpful that glutathione does is it helps your liver change those fat-based Lyme toxins that are getting released from killing them. It helps the liver to take those toxins and transform them from fat toxins into water-based toxins. As water-based toxins, they get mixed in your poop and you poop them out. All right. So with water-based toxins, you don't need a binder because they're already getting mixed into your poop. Okay. So my approach is not to put people on binders to detox because the majority of the toxins that are coming out are actually water-based. All right. Binders are only good at binding fat-based toxins. So what I like to do for Herx reactions is curcumin, 500 milligrams 3 times a day, or sometimes even 1,000 milligrams 3 times a day to block cytokine production in the white blood cells. And if it's really bad, I like to add glutathione. I like using a liposomal variety of glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption, all right? And which helps get it into the cells where it's needed and into your bloodstream where it's needed. And I like using a product for that made by Research Nutritionals called Trifortify. They've got some science that shows that their way of doing a liposomal glutathione actually does get good absorption into the cells and into the body, okay? And so I usually like to do that as 5 milliliters 1 time a day or 5 milliliters 2 times a day, okay? That would be my approach. And I don't bother with the binders because I don't think it's helpful for the kind of toxin issue that you're dealing with, okay? All right. Thanks for that question, Thomas. Let me show everyone. I'm going to do a quick article share here for you, a screen share, and I'm going to show you an article that I've written about this topic. So this is my Lyme disease information site called Treat Lyme. Many of you know I keep telling everyone I'm getting it redesigned, and I am, but my developers have become bogged down in a problem we're having. But I'm hoping still within the next week or so to be able to launch a completely new version of this that I think is going to be a little bit more user-friendly for people. Anyhow, here you can, if there's any question you have about Lyme, I probably have written something about it, okay? So in terms of Herxheimer reactions, what you can do is take a look in my chapters tab here and take a look at Herxheimer and cytokines. All right, and the article that I've written about Herxheimer reaction, there actually is an article I've written. It's this one called Herxheimer die-off reaction. All right, and take a look at it here. I go through the various steps you might use to deal with the Herx. It includes information about the curcumin, includes information about the glutathione too. Okay, now tonight throughout the webinar, you're going to hear me mention a number of supplements, all right? And the thing about supplements, you got to make sure that you're using high quality ones that are from companies that do a good job of sourcing their materials for the most active ingredients, and also ones that tend not to have a lot of artificial fillers in them that might hurt you, okay? So this is my supplement site. It's Marty Ross MD Supplements. I've tried to handpick supplements here that basically have the best chance of helping you and also tend to have the artificial fillers in them that are not going to be hurtful to you too, okay? So if you want to see, for instance, what products do I have that have curcumin in them, you would just do the search function up here. And you're going to see that I have a number of them, but my favorite one is this, where are we here? It's this one called Mariva 500. Okay, that's the one I would wind up using. It's my favorite source, okay? If you're looking for glutathione, you could either type up here, or as I said, you would find glutathione as a Research Nutritionals product. And you just go hit my page on that, and then you scroll all the way down here until you can find the Trifortifies, which I guess are on the next page. So you'd find the various kind of Trifortifies are these ones down here. Okay, all right, let me go back here. gave you some good information. All right. Good luck to you. Hello, Sarita. Let's see. Hi, doctor. I went through a doxycycline 21-day treatment in December for new Lyme infection from Bolivia. I have been asymptomatic since then, but now have a vaginal yeast infection along with symptoms of muscle aches, fatigue, headache, and temperature of 99.0. What is the treatment of Lyme symptoms? The second... There, I think, is a second part. Oh, there we go. The second time around, does this mean I still have the bacteria, or is it just a reaction from the cytokines related to the yeast? Would it be considered chronic Lyme at this point? 5.5 months since my first treatment. All right. So, Serena, you raise a really good question, okay? And so let me kind of break this apart a little bit. So I need to see. So you went through 21 days. All right. So generally, when you use antibiotics to treat acute Lyme, as long as you start those antibiotics within the first 30 days of getting your tick bite, and you take them for at least 3 to 4 weeks as you have, there is a 90% or so chance that you will have gotten the germ completely wiped out and it will not come back and bother you again. Okay. So if you did get treated, I can't tell from the way you wrote the question, if you got treated right away within the first 30 days of your bite, the chances are that this is not Lyme that's bothering you, okay? There's a 90% chance it's not Lyme, okay? So that's one idea, okay? All right. Then the other thing, though, that remember I said that Lyme disease symptoms are actually symptoms of too many cytokines, okay? All right. So if you get too many yeast growing in your intestines, so if you have yeast in your vagina, if you've got a vaginal yeast infection, there's a good chance you also have got too many yeast living in your intestines as well. All right. And too many yeast living in the intestines also get seen by the immune system. And guess what they make? Too many cytokines. All right. So too many yeast in your intestines can manifest and can look just like Lyme disease. All right. So probably if I were, and so symptoms that make you think of too many yeast, vaginal yeast infection. The other things I would see, do you happen to have increased sugar cravings? Are you having a lot of gassiness and bloating, or more gassiness and bloating than usual? Sometimes if you have too many yeast, also you're going to wind up having more pimples and acne, all right? Because the toxins that get released by the yeast get into the skin or absorbed into the bloodstream, get to the skin, and can lead to sometimes pimples and acne, all right? So what I might do in a situation like this is I might try to treat your yeast first by getting you on probably diflucan as a 200 milligram pill, one time a day for 30 days. I might also use nystatin with that. It's a 500,000 international unit pill, 2 pills 2 times a day. And then I would consider using probiotics. And if it is due to yeast, by about 2 to 3 weeks into the treatment, you should start seeing a turnaround in your muscle aches, your temperature, your fatigue, etc. Okay. Usually by 2 to 3 weeks of a good yeast treatment, like a nystatin and diflucan, things can turn around. All right. Now, if you happen to not be able to get a doctor to prescribe these 2 medicines I just talked about, then you're going to need to go more of an herbal approach. And the herbal approach I would use is to use lots of probiotics. Number one, you should even do probiotics if you're doing nystatin and diflucan too. But then I would also use an herbal combination that might have things in it like pau d'arco, caprylic acid, rosemary oil, thyme oil, grapefruit seed extract. You can even get, sometimes they'll have garlic in them too. Okay. So a combination product that might have a number of those things. And I might do 3 pills, 2 or 3 pills twice a day. The thing about doing herbal treatments for yeast, they tend to work about 80% of the time, but they take 2 to 3 months. All right. And I think you're going to want to know quickly, is this a yeast problem? So I would see if you can get somebody to do that nystatin diflucan with you. All right. So yeah, those are my thoughts. Okay. All right. And good luck to you. And I wish you well. All right. Bye-bye. Hello, Bar. Let's see. Can you say how Lyme affects the eyes? Is it the vision, glaucoma, or the optic nerve? So Lyme can impact your vision in a few ways. Number one, it might infect the optic nerve. Because Lyme, we know, can infect nerves, and it causes nerve dysfunction, all right? The other thing it could do is it could infect the muscles that make the eyeball work, that move it into different places. The other thing it might do is infect the muscles that cause your lens to change shape so that it can focus. So sometimes you're going to get into focus issues. And sometimes having Lyme results in a bunch of floaters occurring within your vision as well, too. All right. So those are the kind of the ways that Lyme can affect your vision and the eyeball. All right. All right. Good luck to you, Bar. Hello, Lisa. Let's see. Thank you for taking my question. You're welcome. This morning, my son found an embedded tick on his leg. It was engorged, so that I figured it had been attached for a few days. The ER and urgent care centers only want to prescribe a single 200 milligram dose of doxycycline. I'm not comfortable with that. I'm not either. I think it's ridiculous. So what's happened is the Infectious Disease Society of America, the IDSA, came up with a set of guidelines. I think it's back in 2006 now, and it still tends to be their standard, in which they advised that for an acute tick bite, you give 200 milligrams of doxycycline. And it's a horrible recommendation because it was actually a recommendation made based on one study that was a very small study, and there was not adequate follow-up to know what happened to people 1 month, 2 months, 3 months, 6 months, 9 months down the road, all right? Did that single dose actually work? We don't know. And I don't think I doubt that it does actually. As I already said, when we do the antibiotics for 3 or 4 weeks, even in that situation, you've got a potential 10% failure rate of the antibiotics. So I encourage you to see if you can find somebody that will prescribe for at least 3 to 4 weeks. I think you have better odds of nipping this thing in its bud. That 200 milligram dose is really an untried, inadequately tested method that they came up with. It's just ridiculous. And I see treatment failures of that approach enough in my practice that I think it's a horrible recommendation. So what you would ideally, I usually like to do a doxycycline is 100 milligrams twice a day in children or in teens. And I would do that for up to 3 to 4 weeks. I will tell you there's some an opinion out there that in children that are 7 years of age or younger, that doxycycline might result in staining of the teeth. There have been subsequent studies done looking at that, and even the Centers for Disease Control on its website related to the treatment of Rocky Mountain spotted fever, which is another spirochete. They advise giving doxycycline to children, even 7 years of age or under, because their review of the science about doxycycline and staining of the teeth shows that it does not do it the way that many people think it does, okay? So doxycycline would be my treatment choice. The reason I prefer doxycycline in an acute setting is not only does it treat your Lyme, but it can do a good job of treating other infections that get treated that get transmitted by that tick bite. And that can be things like Anaplasma, Ehrlichia, parasite called Babesia, another bacteria called Bartonella. Those can all be transmitted by tick bite. And in an acute setting, doxycycline seems to do a good job of taking care of those as well too. Okay? All right. Good luck to you, Lisa. I hope you can find somebody to help you with that. Oh, Lisa, one point that I made too, because it may take you a number of days to get convince somebody. Keep in mind that generally if you get treated within the first month for the 3 to 4 weeks, in other words, it gets started within 28 to 30 days or so of that tick bite, you're going to be okay. Your son's going to be okay. So if you have to argue for a day or two to find a doctor that's willing to help you, he should still be okay. You haven't lost any major ground, okay? All right. Hello, Christine. Let's see. I'm being treated for 4 different kinds of mold. let's see, mold. I think you've done a real-time labs. Real-time is a lab that tests for mold toxicity. Have taken cholestyramine, clay, charcoal, chlorella, glutathione, homeopathic drops. 3 molds are now subclinical level. Only mold associated with yeast remains slightly clinical. Should I just continue with the above regimen? Okay. So I think what you've described here is you've had a test done by a company called Real-Time Labs. And Real-Time Labs has the ability to look and test to see if you are peeing out excessive amounts of 4 families of mold toxins. One of those is called aflatoxin. Another one is called ochratoxin. Another one is trichosethine, which is the black mold toxin, actually. And then there's something called gliotoxin. Now, gliotoxin gets to be a little tricky because gliotoxin is made by a variety of molds that we can have in wet buildings, and so we can breathe that in, it gets into our blood. But also, gliotoxin is manufactured by yeast. And if you happen to have yeast overgrowth, sometimes you can have elevation in the gliotoxin. If it is just the gliotoxin that remains at this point, what I would probably do is make sure that you are on something to treat for yeast infection. And that could be things like, well, number one, be on probiotics, okay? Second thing, there's a variety of things you can do. You can either use that phytostan I mentioned earlier. You can use a combination, or you might be on nystatin. You can do just nystatin alone, 500,000 international units, 2 pills twice a day. But be on something that's going to be killing yeast. And then the binder that works can work on its own for a gliotoxin would be your clay or your bentonite clay. You don't need necessarily to be on chlorella, charcoal, or cholestyramine. You could be just working with bentonite clay. I have a good version of bentonite clay here called Medi Clay, and it's a 500 milligram pill. You want to do at least one of those 3 times a day is usually what I have a person do. Sometimes I'll go up to 2 of those 3 times a day. But if it's just gliotoxin left, and I think that's what you're describing here, you don't need those other binders and even the glutathione at this point. Probably can just do it by treating for yeast, treating for yeast in case it is yeast producing it. And then secondly, I would consider just using a Medi Clay or a bentonite clay by itself, okay? All right. Good luck to you. Thank you for that question. All right. Actually, so I'm going to just remove that. I'm going to say a few things here. So I think I think this is the second person that's addressed something about mold toxin illness. I just want to say a few things. Okay, so there's this thing called mold toxin illness, all right? And basically what happens is 25, according to the work of Richie Shoemaker's a medical doctor that is located out on the Chesapeake Bay in Pocomoke, Maryland, on one of the river tributaries of Chesapeake Bay. And he's done some work that shows that around 25% of people have genetic programming that makes it very difficult for them to remove mold toxins once they get into them. Okay, so it's a problem that occurs in 25% of people, and that's people that have or don't have Lyme. Okay, this is 25% of all people. All right, and so basically, what happens in people that don't have this problem is we breathe in, eat in, drink in a mold toxin. It gets absorbed into our bloodstream, and then our immune system see it, and they tag it for removal. It gets broken down, and those toxins get out of us. Okay, that's if you're one of the 75% that don't have the genetic defect. If you're one of the 25%, though, what happens is they don't get tagged correctly to get broken down. They go to the liver as a fat-based toxin, and in the liver, it can't change them into a water-based toxin, and those fat-based toxins get moved out into the intestines, and they don't mix in our poop well. They get reabsorbed back into the bloodstream. All right, so you get this swimming pool of toxins that just keeps going round and round, and they trigger cytokines. All right. So one of the things so you want to get rid of them, you need to bind them with binders, okay? And the last question talked about a number of those binders that you might use. I like testing to see if somebody actually has the toxins in them by doing a real-time lab test. As we mentioned earlier, Dr. Shoemaker, who came up with the theory, though, doesn't believe in doing that testing. He looks to see if you have the genetic defect and then decides if he's going to treat based on that. It's a test called an HLA-DR test. I don't think the test is accurate, actually. I think it overestimates sometimes who has it and misses people that have the problems. And I've moved much more in the direction of actually looking to see, do you pee out excess toxins? And that's to use that real-time test kit, okay? So the other point I want to make about mold toxins is many of you know I have a Lyme disease treatment protocol called the Ross Lyme Support Protocol. One thing that I say in that protocol is before you start to treat your Lyme, make sure it's not mold toxin illness, all right? If you know you have been exposed to mold and you got sick during that mold exposure, okay, treat your mold toxins first. Even if you have positive lab testing for Lyme, treat your mold toxins first in that kind of a situation, all right? Because it's very possible that, remember, both mold toxins can trigger cytokines, Lyme can trigger cytokines. It's actually what I have found in my practice is that not everyone that has a positive Lyme test that says they have Lyme in them actually needs to be on antibiotics, because many of us walk around out there and our immune systems keep our Lyme under control. It doesn't cause us a problem, all right? So just having a positive test for Lyme does not mean the germ is causing you a problem. It may mean your immune system has walled it off and is taking care of it fine, and that the symptoms that may look like mold or Lyme disease may actually be triggered by mold, all right? So for instance, I've got a patient of mine recently that came to see me that had positive Lyme disease testing. And but when I took his history, it was very clear to me he got sick after living in a house for which he knew there was mold in the house, all right? And so what we chose to do first, I said, I don't think this is Lyme. I think this is mold toxin illness. They can look the same. So he was extremely confused, severe pain, bad fatigue, non-functioning, had been that way for years, actually, no longer able to work, etc. And within, I think, about 3 months or so of us actually just working slowly to pull those toxins out, he regained most of his health. And by 6 months, he's back at work and healthy as all get out. And I never did anything about the Lyme, because even though he tested positive, if it is in him, I think his immune system has handled it, okay? So, and I have a number of stories of that same kind of situation, whereas I take the history, I learned the person got sick when they were living in a place that they knew had mold. You need to start by taking care of your mold first in those kind of situations, all right? So I'm going to show you 2 articles here that I want you, just to make you aware. You can go back and look at these later, all right? So I'm going to do a quick screen share here. Which one do we want to look at here? So in the detoxification chapter, I do have an article about mold and Lyme toxin illness, okay? And this is where I talk about, I tell you, depending on what your mold toxins are that you pee out, I describe what is the better binder to use. I talk about how do you test for mold toxin illness. Basically, anything you want to know about mold toxin illness, I got it here in this article, okay? So you might want to take a look at that. All right. Second thing is my Lyme disease treatment protocol is called the Ross Lyme Support Protocol. And I would take a look at this. I recently rewrote this and republished it. All right. And if you want to see a version here that you could even print, I have a short version, which is just the herbal parts of it. And I have a long version, which includes both the herbs and prescriptions you might use. Okay. Now, this protocol is basically the foundation of what anyone should be doing as part of their Lyme treatment. If you're going to get rid of Lyme, you've got to do more than just poison your germs with herbal or prescription antibiotics, all right? And so you'll see as you look through here, I say before you start, make sure it's not mold toxin illness, okay? All right, it's one of the first things you got to do, all right? All right, other things you need to do, you got to get sleep. You need to be, I like to suggest people be on a healthy diet called a paleo diet. I like to lower cytokines. I already told you about what cytokines are. You want to lower cytokines because if you're making too many cytokines, they give you a lot of symptoms, but they also suppress the immune system, okay? You want to make sure that you're doing something to help your body deal with the stress of the illness. I like using ashwagandha to do that. Figure out if you have low hormones, and if you do, fix those. And I talk about various ways to do that here. Be on a good multivitamin. Do some basic detox steps, including being on that liposomal glutathione I was talking to you about earlier. Talk about taking care of yeast, getting it out if it's present. And then in here, I give you various ways, herbal and prescription, to deal with the Lyme infection and also to deal with your co-infections like Bartonella and Babesia. Okay, so I know I just went through that really fast. Point wasn't to actually go through it point by point, but go ahead and take a look at that. Make sure you're dealing with every one of those issues that I raise in there as part of your foundation treatment, including things to make sure you're getting sleep, be on ashwagandha, lower your cytokines with curcumin, and deal with your infections. But absolutely, at the beginning, make sure that this wasn't mold toxicity illness if you have an obvious history where you were living in a mold building when you got sick. Okay? All right. Hope that gives you all some information there. And let me go back here. Hello, Kay. Let's see. Hi, Dr. Ross. For the past 4 years, I've gotten a cortisone injection in my hip for bursitis. I was just diagnosed in April with Lyme. Is it a terrible idea to get my annual shot that I only get because I just started limping after 9 months or so, and I stretch it out as long as I can? All right. So steroids get to be a little bit of a tricky issue. So steroids and Lyme can cause some problems. So Lyme disease is difficult to treat. You want to make sure your immune system is helping you. And your immune system, in many of us, actually keeps our Lyme under control. If it's living in us, the immune system can keep it under control. We don't often have to use we don't always have to use antibiotics, okay? All right. The problem when you get steroids is that they can suppress the immune system. And that can allow Lyme to grow more easily. All right. Now, if you're going to get, I prefer, therefore, not to have people get steroids. And even though they're injecting it right into the bursa, which is this fluid sac that separates your muscle tendons from your bone, some of that's going to leak into the bloodstream and could potentially suppress your immune system. Okay. Now, if there's no other way to control that pain, sometimes I'll say, yeah, but be careful, you can do it, but just realize you may be making it more difficult to treat your Lyme. All right. Those are my thoughts on it. Good luck to you, Kate. Hello, Terry. Let's see. Hi, wondering about treatment for optic neuritis brought on by tick-borne disease. Seems the only treatment is steroids, but Lyme patients can't take that. Suggestions? So again, there's times if your vision is being lost in a way that could be harmed by continued inflammation, you may need to do the steroids. Again, there are times you may have to do it, okay? But as soon as that vision gets better, make sure you're on antibiotics, get that under control. That would be how I would handle it, okay? All right. Good luck to you, Terry. Hello, Greg. Let's see. Hello, Dr. Ross. Thank you for taking my question. You're welcome. I wanted to ask about your opinion on hyperthermia, whole body treatment to approximately 107 degrees Fahrenheit, that some of the German clinics offer together along with other therapies. Okay. So actually, Greg, let me just make sure that was your whole question. I just need to scan up here and see if there was more to it. Nope, that looks like it. Okay. So hyperthermia, heating yourself up, is, and to high temperatures, I know they're going to 107, you can even do 100, 300, 4 degrees too, in that range. But if you heat up to high temperature and you can maintain that for about 15 to 30 minutes, that can kill germs. In fact, where we got the idea to try that for Lyme comes from syphilis. So syphilis was a very difficult infection to treat and prior to having antibiotics. And the way that it used to be treated was with hyperthermia. Okay. All right. Now, the German clinic makes some claims that I think are a little bit of an overstatement of the benefit of hyperthermia. They claim that you can cure it with the hyperthermia, or that people get cured. And that's because they think that the hyperthermia can kill Lyme wherever it lives. In theory, that might be true, but that's not what I see. I see a number of people that come back from the German clinic treatment that basically get worse after they get back, and we got to go back on antibiotics. So it does not always kill every germ. Could it be something that helps? Yes. But keep in mind, one of the reasons people get benefit when they go there is also while they're there, they're on IV antibiotics at this one program. And they're doing detox work with IV glutathione. And I think they're doing one of the clinics, if I'm correct, is I think doing some IV hydrogen peroxide as well too. So if people get any benefit, it might not even have to do with the hyperthermia. If hyperthermia worked so well, we wouldn't be using antibiotics, I'll put it that way. It doesn't work as well as they say. Could it be something that might benefit you and move your treatment along? Perhaps. Do I think it's basically eradicating everything from the body as they claim? No. I think in the majority of people, it probably does not. All right? All right. Good luck to you, Greg. Thank you for that question. Hello, Christine. Hold on here just a minute. Let's see. Hi, Christine. Let's see. Until the mold numbers are at 0, or are all people going to have some mold based on the real-time lab test? Also, what is the best for yeast mold? Is this, oh, okay. I think I already answered your question earlier. So for yeast, you want to do bentonite clay. It's possible that the gliotoxin that I think you're talking about, which comes from yeast, may just remain slightly elevated in the course of a Lyme treatment because being on antibiotics makes it easier for yeast to grow too much in the intestines. Okay? All right. Good luck to you. Hello, Terry. Let's see. Hi, wondering about the treatment for optic. Oh, we already answered that one. Hello, Sue. Let's see. I was treated with antibiotics for 3 years for Lyme, Bartonella, and Babesia. Have been off for 2 years with occasional sessions of Banderol and Cemento. Recently bad but migrating large joint pain and frequent muscle seizing up along with occasional night sweats and air hunger are concerning. No new tick bites, but several mosquito bites. What do you recommend? Sue, it sounds to me like your Lyme symptoms are getting active just from that brief description. I think you might, if you have found that even limited use of herbs like Otoba, which sometimes Nutrimedics has as a product called Banderol, or Cat's Claw, which they call Cemento, if you have gotten benefit from this before, you might want to just start using those on a more continuous basis, actually, to get your germ under control. The other thing I can't tell from your description here is whether it is just Lyme by itself, or does it look like your Bartonella or your Babesia have gotten active again too. Typically, what I find in my practice is when you treat Bartonella, you'll eradicate it about 95% of the time. That means there's a 5% chance it can come back. And when you treat Babesia, you'll eradicate it about 95% of the time, but there is a 5% chance it can come back. But when you get into a relapse situation, if it is one of the Lyme or co-infections, generally Lyme is going to be part of that, okay? The other thing that you should make sure of is it a yeast infection, all right? As I mentioned tonight, if you get too many yeast from having been on Lyme, herbal, or prescription antibiotics in the past, if you start getting too many yeast in your intestines, they trigger too many cytokines to be made. And if you get too many cytokines being made, that can lead to a return of Lyme symptoms. So to consider if it might be that yeast has gotten active. And so I can be interested in knowing, do you have increased sugar cravings? Do you have increased intestinal gassiness or bloating? Are you having any vaginal itching or vaginal discharge? Have you had some new pimples or acne starting to show up? Okay, those would be things I'd be interested in knowing. Okay, all right. Good luck to you, Sue. Hello, Colleen. Let's see. Hi, Dr. Ross. My dad is on blood thinner, 5 milligrams of Eliquis. Is taking curcumin safe for someone on blood thinners Thank you for all that you do. Yeah, I think it is. I use it for people on blood thinners, and I have not had any problems with that. All right. So I think it is okay to do that. It doesn't interfere. So curcumin, being anti-inflammatory, does not work in the same way that aspirin does. Now, your dad would not want to be on aspirin that interferes with platelets and blood clotting. Curcumin doesn't have that effect, actually. Okay. All right. Good luck to you. Good luck to your dad. Hello, Brenda. Let's see. I have Lyme and Bart. My doctor has me taking minocycline 100 milligrams twice daily and rifampin 150 milligrams twice a day. Does this sound like a good combination? What else would you recommend? I have a lot of buzzing, tingling symptoms. Would IV antibiotics work better? Thanks for your help. So, in terms of this regimen, this is a good Lyme and Bartonella regimen in terms of being on minocycline and being on rifampin. It can take care of both, okay? However, I think your doctor has dosed the rifampin too low. I like to use my rifampin so that a person is taking a total of 600 milligrams, at a minimum 600 milligrams in an adult, all right? So you're at half of that dose. So minocycline is an antibiotic that is very useful at getting at nerves and even penetrating the brain. For Lyme, it treats spirochete Lyme, which is the corkscrew-looking thing that many of you have seen pictures of. It also treats Lyme that lives inside of the cells, called intracellular Lyme. Okay, so it can take care of both of those. The rifampin can treat intracellular Lyme and take care of the cyst form of Lyme. So those two together are a good combination for dealing with your Lyme. For Bartonella, I like to use at least 2 antibiotics that get inside of cells, and both of these do that. Of the 2 of them, rifampin is actually your best agent against Bartonella, and the minocycline is helping it. But to be effective, you got to get at a higher dose. So do I like the antibiotics? Yes. I think the dosing is not good enough, okay? Now, could you get better any quicker with IV antibiotics? Maybe, but when it comes to Lyme, IV antibiotics may work about 95% of the time. Oral antibiotics work about 90% of the time. All right, so you're not getting much greater chance of improvement by being on IV antibiotics. And there's a great risk of being on IV antibiotics because you got this IV line in you, and that IV line can become infected, could lead to blood clots, could lead to infection getting in your bloodstream too. So for what you've just described, I don't think it would be worth it. I think I would stay with oral, but you might want to talk to your doctor about bumping up that rifampin. Okay, now 85% of the time, a 2-drug combination for rifampin will work. Sometimes you got to go 3-drug combination. Okay, so I'll just throw that one out. If you're wanting more ideas about combinations of antibiotics that you could use for Bartonella, let me just do a quick screen share here. See here. All right, so take a look in my chapter and look in the infection treatment plan section here. And there is an article that I've written about how do you kill Bartonella, where I give you various antibiotic options that you could try. Let me see. That's this one here called Kills Bartonella, a Brief Guide. Okay. So take a look at this. I talk about various antibiotics, and I even lay out, I believe, some 3-drug regimens that you might consider using. So I would definitely take a look at that if you want some more ideas. And I do talk about the dosing, the correct dosing in there as well too. All right. Oh, Brenda, one other thing that you might want to consider while you're waiting for the antibiotics to work is make sure you're doing things to support your nerves. And at a minimum, I would get on some of the glutathione. Remember, I mentioned earlier in the webinar tonight that glutathione is a master antioxidant that can help with repair injured cells, and it works from the inside. So you might consider adding that Tri-Fortify product I talked about earlier by Research Nutritionals, 5 milliliters once or twice a day, okay, to help with the nerve repair. The other thing that can help with nerve repair is to try to fix the injured nerve from the outside. to fix the cell covering itself. And what I like to use to do that is a product called NT factor that is made up of the fats that make up your nerve cell membrane. And you would do that as NT factor, which also happens to be made by research nutritionals. It'd be 2 pills 3 times a day for 2 months, and then decrease it to 1 pill 3 times a day. Okay. Now, if you're looking for other things you can do to repair those injured nerves, let me show you. All right, so this is my brain and nerves chapter. All right, and what you would want to do is take a look down here. There's an article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. Look at this. I give you a number of ideas to fix the nerve injury here, okay? The other thing, glutathione and the NT factor that I just talked about, is make sure you're on the curcumin I mentioned earlier that decreases the inflammation of the nerves, okay? And that would be 500 milligrams 3 times a day on that, all right? All right. Good luck to you, Linda. Oops, that wasn't Linda. Linda's my next person. I'm sorry. But good luck to you with your nerve repair, okay? Hello, Linda. Let's see. I went into remission last December. I was diagnosed with cancer and had surgery in February. I'm now noticing a few symptoms showing up, mostly neurological, roving pain. I started taking beta-glucan for cancer. What do you know when to start treatment? When do you know when to start treatment again? Okay. So one of the things I would point out, it's a very peculiar symptom for Lyme, is this issue of wandering symptoms. Okay, so often it can be wandering neuropathy, or it can be wandering joint pain, or wandering muscle pain. And one of my colleagues, Richard Horowitz, who's out in New York State, has written a book about Lyme disease treatment, has been looking at, he has a questionnaire about helping people figure out if they have Lyme. And he's been looking at the validity of his questionnaire. One of the things he's finding out in some of his research is that when you look at this roving quality of symptoms, that is a very, very strong indicator of having Lyme being active again. Okay, all right. So the one thing that I would make sure of before you decide to start treating Lyme, and I mentioned it a number of times tonight already, and that is make sure it's not yeast that has gotten active. Okay, so if you've had surgery and you had cancer treated, there might have been some suppression of your immune system, and there might have. I don't know exactly what they had you on, but there is the possibility that yeast could have gotten active in your intestines. Also, from having been on Lyme antibiotics in the past, that's a setup for getting too many yeast in your intestines, okay? So make sure you don't have too many yeast because they kick up cytokines and it can look identical to Lyme, all right? So the questions you need to look at again are, do you have increased sugar cravings? Are you having any problems with intestinal gasiness or bloating? And are you having any vaginal itching, vaginal discharge? Also, one of the things that yeast can lead to is it can increase the chances of pimples and acne showing up, okay? So if you have a number of those things, you might want to treat yeast first before you turn and decide if it is Lyme or not, okay? All right. Good luck to you, Linda. I hope that gives you some insights. Hello, Joseph. Let's see. I am unclear about how and when to take the natural REI. I am totally unclear about how and when to take the natural remedies. Okay. I've been taking cat's claw. I recently purchased grapefruit seed extract, only taking it a few times. I recently ordered the Otoba, but have not received it yet. Okay. I think I'm just looking to see, Joseph, I see that you clarified what you meant by that top there. Okay. Right here. Joseph, I want to see if there's another part to your question here. Okay. Okay, so Joseph, I don't know that I don't think you need the grapefruit seed extract. I'll just start by saying that to begin with. So grapefruit seed extract is an herb that I use to treat the cyst form of Lyme, and I'm going to use it in combination usually with a prescription antibiotic that's treating the spirochete form. That's a thing that looks like a corkscrew, and intracellular Lyme. Okay. The reason you don't need it if you're using Otoba and cat's claw is that Otoba and cat's claw also treat the cyst form of the Lyme germ. All right. And Otoba and cat's claw, according to Petri dish experiments that got published about 6 years ago, do a good job of treating spirochete, intracellular, and cyst Lyme. They also remove 100% of a slime layer that covers Lyme called a biofilm. All right. So those are the two that you would need. And until it arrives, I don't think you need the grapefruit seed extract. In terms of taking the cat's claw and taking the Otoba, you can take them both together at the same time. All right. I have people start to take them by taking 5 drops in the morning, 5 drops at night. And you can mix the both of them together. You can literally squirt it in your mouth, or you can put in some water and drink it. Okay. And what you usually do is start at 5 drops twice a day and increase by 1 drop per dose every other day, working up to 30 drops twice a day. All right. So first part of this is be on them twice a day. All right. Second thing, you'd want to take them without food. So they need to be taken on an empty stomach, at least empty of food. And the way that you do that is you don't want to take them beginning half an hour before you eat, and you don't want to resume them or restart them again until at least 2 hours after you eat. Okay, so food, there is a 2.5 hour window around your food that you can't take them. So don't take them beginning 30 minutes before you eat through 2 hours after you eat. Okay, now you can, however, take them with other medicines and supplements. So you could take them with your curcumin if you want to, for instance. Okay. Now, the only supplement you don't want to take them with is your probiotics. The probiotics you're using to prevent too many yeast growing in your intestines. And the reason you don't want to take it with your probiotics is they'll kill them. Even though they're herbal antibiotics, they still can kill probiotics. Okay. Now they have less of a chance of doing it than prescription antibiotics, but they still can. Okay. So I hope that gives you some insight on that. All right. Good luck to you, Joseph. So everyone, if you're wondering what Joseph is talking about, my 2 favorite herbs to treat Lyme, and they happen to be the 2 herbs that I build into Nutramedix has sold them before as a product called Banderol, another one called Cemento. Nutramedix recently made it so that they are the only people that sell it now and jacked up their prices too high. So I use a lower cost alternative that I'll show you right now. So as an alternative to doing the Nutramedix, Cat's Claw, and Otoba product, what I'm carrying these days is a product made by a company called Wildcraft Herbs, which is a manufacturer out of British Columbia. And they have a Cat's Claw product. I'm just circling it right there. And they have an Otoba bark product, and I'm just circling that right there as well too. Okay, all right. So those tend to be what I am using these days. All right. Now, if you want to know more about these and why I use these products, take a look at. I have an article about it, and I'm just going to search it here real quick. So there is an article that I have written in Treat Lyme where I talk about the ins and outs and why these are good things to use, their chances of working, and even the research about them. You can take a look at that here at this article. Okay? All right. Back here. All right. I hope that gives you some insights. Okay? All right. Hello, Kay. Let's see. Hi, Kay. Let's see. Also, does Neuroprotect cause increased phlegm? And if so, what should I take instead to stabilize mast cells? Thank you. So Neuroprotect, everyone, is a supplement that has in it something called luteolin, 100 milligrams per pill, which is a bioflavonoid. It's got some limited amount, very small amounts of something called quercetin, and it's got some rutin in it as well too. All right, but the main reason to use it is it's got high concentrations of luteolin. All right, so let's talk about this. So mast cells, everyone, are a type of a cell, immune system cell, that historically we have thought has only been involved in allergies, because inside mast cells are where histamines are made. And if you're allergic to something, it lands on a mast cell, and that mast cell then releases its histamines and gives you all those allergic type symptoms, okay? There, however, is newer research that's been coming out over the last 10 years or so showing that mast cells actually get turned on and start releasing their histamines due to chronic infections, all right? So there is some research showing that even having a Lyme infection causes these mast cells to release their histamines more easily. Now, the mast cells don't only make histamines, they make cytokines too, all right? So there are certain supplements that can stabilize mast cells. One of those is the luteolin, and that you can get in that Neuroprotect. You're going to do it, it's 100 milligrams per pill, and you would do one pill twice a day, up to one pill 3 times a day, okay? Now, if you happen to not be tolerating it, and there's a Marty Ross rule in medicine, and that is that, and this is for herbs or prescriptions, and my rule of medicine is anything can happen to anyone with anything, all right? So all of us can have side effects that are very unique to us and how we interact with certain medicines or supplements. So far as I've been using the Neuroprotect with my patients, I have not seen people have the kind of problem that you're describing, okay? But clearly you are. So I would not use that. What I would probably shift over to is to try the quercetin that I mentioned in my mast cell activation syndrome article. And that quercetin is a 250 milligram pill, and you would do 500 milligrams 3 times a day, or 2 pills 3 times a day. Now, the Neuroprotect has a little bit of quercetin in it too, but it's marginal. It's practically non-existent compared to what you're going to get in a quercetin tablet that I just mentioned. Okay, all right. So for those of you that are wondering, what is he talking about, mast cell activation syndrome? Let me just show you a quick article on that. Just trying to click it up here. Okay, so this is a article called Mast Cell Activation Syndrome. Think about it, if your Lyme has a lot of allergy or asthma type symptoms associated with it. Those would be the big reasons. Or if you tend to be a person that's reacting to everything, or has become very sensitive to all kinds of foods, has become chemically sensitive, or has allergic type symptoms, think of mast cell activation syndrome as part of your condition. And I have a whole article that I've written about that here. Okay? All right. Hello, Lisa. Hold on here just a minute, Lisa. Hi, Dr. Ross. Hello. Let's see. Do you have suggestions for the liver? When I started killing Lyme, my liver suffered. I became jaundiced and liver enzymes temporarily elevated, but have since come back down with glutathione, milk thistle, and dandelion. The area around my liver has hurt for 2 years. Ultrasound was normal. So you're already doing what I would do. So my favorite thing to support the liver in terms of keeping the liver enzymes down, supporting detox, and helping to control liver inflammation is glutathione. And I usually like using it as a liposomal variety, as I've mentioned tonight. And I would do anywhere from 400 to 500 milligrams twice a day, all right? And that sometimes just by itself is going to be enough, all right? Now, the liver is involved in detoxing chemicals. And we recognize that there's 2 phases to detox. There's something called phase 1 and phase 2, all right? We really get tricky with our words here, all right? So in phase 1, fat-based toxins go through these chemical reactions called phase 1 detox. and they go through the phase 1 detox, and actually at the end of phase 1, they come out more toxic than when they went in. All right. Then they got to go through phase 2, and phase 2 changes them into water-based chemicals that are not toxic, and then they get moved out into the intestines, and we mix in our poop, and we poop them out. All right. Now, glutathione supports phase 2 much more strongly than it does phase 1. Milk thistle, on the other hand, supports phase 1 more strongly than it does phase 2. Okay. So the issue here is I don't like using milk thistle by itself, and here's why. Many of us have a blockage in phase 2, and we do phase 1 okay. So now, if you start using milk thistle that supports phase 1, and phase 1 produces things that are more toxic than when they went in, and you have a blocked phase 2, guess what you've just done? You've increased your toxin load, okay? And milk thistle by itself is going to support more phase 1. So if you've got blockage in phase 2, that is going to produce problems for you, all right? So if you're going to do milk thistle, I prefer that people do it in combination with glutathione. That's the point I'm trying to make. Or just use glutathione by itself. It's going to support phase 2 and phase 1, probably phase 2 a little bit more strongly than it does phase 1 detox. All right? All right. Good luck to you. Hello, Mariah. Let's see. I developed a rash on the thighs that looked like stretch marks. Thought it could be Bartonella. Started Sida acuta and Houtunia. Also had tendonitis from repetitive lifting. Herbals went directly to the knee pain and burned excruciatingly for a couple of hours. Why would herbals respond this way? I don't know. I actually have not seen that occur before, Mariah. As I was saying earlier, as I mentioned earlier, anything can happen to anyone with anything. What I would try to do is, instead of using both at the same time, I would, after this quiets down, I would try one and try to see, do you respond to that one? Does that give you the problem? Okay. Try to identify which one of these is doing it and then stay away from it, basically. All right? Okay. Good luck to you, Mariah. Hello, Jackie. Let's see. Good evening, doctor. Hope all you are great. I assume by all you might even mean my either my clinic staff, or you mean my friends, the Basenjis that come to work with me here, my two dogs. Thor is over there just snoring away right now. He's hoping I eventually stop doing this webinar so he can go on his walk. And Halo is just sleeping under the desk there. But anyhow. All right, so let's see. Since I have 25 years of untreated Lyme, I again need 21 days of doxy for new tick bite. Was wondering, is there a typical time one may start to herx? I imagine it varies. I'm taking curcumin and okiash. Just wondering, so I'll know when I face my treatment long-term for long-term Lyme also. I looked on your site for a product you recommend. I called Research Nutritionals. They assured me most of their products are vegan. I want to buy supplements from you when possible. Would you please ask companies about products you currently sell which are vegan? It's a good question. I'll look into that. I'm sorry. Usually they will post on a label if they truly are vegan or not. They will post it. I haven't gone to make sure well enough with my products that they are or not. So thank you for raising that point with me. In terms of how quickly does a herx begin, it depends on the antibiotics. Typically, with a tetracycline, like the doxycycline you recommend, that you mentioned, it's going to be within 1 or 2 days, typically on that one, okay? Another antibiotic sometimes people use is something called Zithromax. That sometimes can have a herx that's delayed for a week or so. That's because Zithromax can take a good week or longer to build up high concentrations in your cells, and therefore it takes time to get into a good killing. Other than Zithromax, though, most antibiotics, it's going to be within maybe 1 to 3 days or so. You'll start to have your herx reactions if you're going to have them. Okay? All right. Good luck to you, Jackie, and thank you for raising that issue. I'll have to take a look at that. Let's see here. Hello, Mindy. Let's see. Hi, Dr. Ross. Florida must have been good to you. You look happier on this webinar. Thank you for all you do. I appreciate that. I actually did, yes. Last week I was everyone. I was not at the webinar last week because I take every fourth week off from the webinars. But one of the reasons I was gone last week is I was at a medical education conference in Florida, hosted by a group called the Institute for Functional Medicine. It's where I learned a lot of alternative medicine and integrative medicine ideas. And so it was a really good conference. That was began Wednesday evening and went through Saturday. But before that, I did take a number of days, and I had the chance to spend some time in Miami South Beach, and worked my way down to Key West for a couple of days too. So I had about 4 days where I was able to play, and it was good. It was good to take a break. So thank you for mentioning that. Maybe I'm still wearing that well. Thanks, Mindy. Hello, Mariah. Let's see. Do you think that co-infections can cause or exacerbate tinnitus? Yeah. So, and thank you for your comment. Thanks for all you do. Thanks, Mariah. So tinnitus is caused by inflammation of one of of your hearing nerve, basically. And so what can give you neurologic problems? Two things. Number one can be Lyme. And the second one, infection-wise, could be Bartonella. Both of those could be related. Those two infections could sometimes be a cause of tinnitus. Now, keep in mind that tinnitus, which is that ringing in your ears, sometimes just happens in people and it has nothing to do with Lyme, because people that don't have Lyme also can get that problem as well, too. The other thing, certain medications that people take sometimes can make that worse. So, for instance, the macrolides, which would be Biaxin and Zithromax, generally are just not a good idea when people have tinnitus, okay? So sometimes when people have bad tinnitus, I'm going to look and make sure if there are other medications I might want to use instead of those, okay? All right. Thank you for that question. Hello, Sarita. Let's see. Hi, doctor. When I got Lyme in Bolivia, I took Doxy that I was able to buy over the counter in a very small town in the middle of nowhere. It made my symptoms go away, but I'm nervous about the quality of the drugs. 5 months later, I have symptoms in the vaginal yeast infection. Yeah, again, Sarita, I know I mentioned this earlier. I mentioned earlier, what I would probably do in your situation is go after yeast first. I understand your question about the quality of the doxycycline. What I would suggest, though, is that there's probably a greater chance, at least from what you're briefly describing to me. I don't get to ask you a lot of questions here and hear a response from you on that. But I would probably look at going after the yeast. All right. Thank you for that question. Good luck to you. Hello, Naomi. Let's see. Son with Lyme Bartonella, high IgG for Mycoplasma, HHV6, Epstein-Barr virus. Only symptom is OCD, anxiety. I'm minocycline, Plaquenil, rifampin, probiotic, and anti-yeast herbal. Detoxing heavy metals, no mold. OCD has improved somewhat, but general anxiety has gotten much worse. Could that be a Herx reaction? Thank you. All right. So, just looking at what you're on here. So the one thing you've got to be concerned about when we use any of these antibiotics is there's not only can they kill the germs and give you a Herx, okay, all right, but also some of them having side effects as well too. So minocycline I have seen lead to more anxiety. I have also seen that occur with rifampin as well too. A Plaquenil can be neurotoxic at times, and although I haven't quite seen it lead to more anxiety, What I would be inclined to do with this, if your son's OCD is improved, it could suggest that these are working. But so therefore, the fact that he's gotten anxiety says to me maybe more of a side effect. And I'm just trying to think of if I would probably try to stop one antibiotic, either the rifampin. Actually, I'd probably stop the rifampin first. Stop it first. Don't replace it with anything right away. And see if over 2 weeks, does the anxiety go away? If so, you've got a rifampin side effect, okay? Now, the reason I chose to do that instead of the minocycline is minocycline is a fat-soluble medicine. And things that are fat-soluble get into our fatty tissues, and they take a long time to get out, all right? So minocycline, because it's so fat-soluble, it literally crosses into the brain very easily. And it can concentrate in the fat that covers nerves. And when you stop it, when you've got something, so what happens when it concentrates in the nerves, it can become an irritant to the nerves. It could lead to more anxiety. But it could take a good month or so after you stop minocycline for that kind of anxiety to go away. So if you're trying to see which antibiotic it is, the rifampin gives you a quicker response. After about 2 weeks, you'll know if it's the rifampin that was giving you anxiety or not. The minocycline, stopping it could take about a month to figure that out. Okay? All right. Good luck to you, Naomi. Thanks. Okay. Hello, Pat. Let's see. What is your opinion of LDI and LDA? Can you combine them with antibiotics? So, LDI stands for low dose immunotherapy, and LDA would be low dose allergy therapy, basically. All right. So what LDI and LDA involve doing is giving you super diluted doses of the thing you're reacting to. So in the case of Lyme, for instance, giving you super diluted doses of Lyme infection or dead Lyme germ, if you will. In fact, diluted like thousands of times, for instance. LDA would give you, could be LDA on the other hand for things you might be allergic to, super diluted amounts of those things you might be allergic to. And you progressively increase. And what it's supposed to do, in theory, is it's supposed to alter the immune reaction to the germ. And it's supposed to balance out different kinds of inflammation that we have in our body by raising a chemical called or a type of white blood cell called a T regulatory cell that is supposed to help balance out inflammation from infection and inflammation from allergies, okay? All right, now, this was the rage probably a year or 2 years ago. There's a physician up in Alaska named Ty Vincent that came up with the idea of trying this for Lyme. People were rushing off to get it done. I even started offering it in my practice. Generally, I have been disappointed with it, and I just don't offer it anymore. There are occasional people that do get benefit from it, so I'm not going to say it never works, but I decided to stop offering my practice because I just don't see enough consistency about its benefit, basically. There are occasional people that get harmed by it as well, too. So it's one of those things, I put it down lower on the list of things to try, actually. Okay? All right. Thanks for that question, Pat. Hello, Pat, again. Let's see here. Upper left chest pain, which increases with exercise and taking antibiotics. What is it? Lyme, Barter, Babs? Thank you for these webinars. Pat, it's hard for me to say, but the one thing I don't know, if I knew your age, I might be able to have a better response here. But if you happen to be in your 40s or above and you're getting chest pain with exercise, that means make sure you're not having problems with your heart in terms of having restricted blood flow. That means seeing your family doctor or seeing a cardiologist so they can do some testing to figure out if that's so. That's where I would start first, okay? You want to make sure it's not your heart. If you tend to be younger, then it may not be your heart. But if you're 40 or above, I would go looking at your heart first, okay? All right. Good luck to you. Hello, Michelle. Hi. Is treating the gut very important? I heard there is a connection between the gut and mood. Should I be treating my gut? If so, what should I take? Um, that's a big question. So, the problem. So, yes, there's a lot of newer science coming out showing the relationship between what's called the gut microbiome, which is the bacteria, chemicals made by the bacteria, detoxification that happens in the intestines, healthy viruses that live in the intestines, healthy yeast and fungus that live in the intestines, and the relationship between how they affect both our nervous system and affect our immune system. Okay. So part of the problem when we treat Lyme is that we have to put you on things that alter that gut microbiome. And, you're kind of damned if you do and you're damned if you don't, because you got to get the germs out, but you got to do the best you can to support the gut bacteria and microbiome as you can. So the best you can do while you're on antibiotics for Lyme is make sure you're on good probiotics. That just happens to be the best that you can do. It'll be interesting to see. There is a newer treatment that's being used to treat a bacteria infection of the intestines called C. difficile that is basically to give people what are called fecal transplants. They are given a stool from somebody else, and that's meant to repopulate their intestines with healthy bacteria and germs that can fight this infection called C. difficile. The FDA is only allowing these kind of treatments to formally be done for C. difficile. I wonder if it might be down the road that we see that this might be a useful treatment actually for people with Lyme after they've been on antibiotics for a while to repopulate their intestines with really good bacteria to help their microbiome work better with detox, interactions with the nervous system, interactions with the immune system, okay? But it's a treatment that is out of limits for right now because of FDA regulations and rules around that as well, too. All right. So the best I think you can do to treat your gut is support the good bacteria there. And the way I would do that is with good probiotics. And I like using the probiotic I like is to use something called HMF Forte. I would do 2 to 4 pills 1 time a day. You can also add to that a soil-based probiotic, something called a core biotic. And I might do up to maybe 4 pills 1 time a day on that. Okay? All right. Those are just some general thoughts. Oh, actually, I should say too. The other thing is make sure that you're having a good balance of vegetables daily. The fiber is useful from those to support the gut. Also, various changes in various colorful, use different colors like green, reds, oranges. Vary your vegetables so that you're getting a good introduction of color. And when there's studies that show that being on good vegetable diets or having vegetables as part of your diets is going to be very supportive of the microbiome as well too, and that fiber is as well too. Okay, all right. Thanks for that question, Michelle. Hello, Joseph. Let's see. Could you explain the procedure for a short telephone conversation with me? Yeah. So I'm going to actually, while I'm doing, I'm going to do a screen share here. Hold on here a minute. Online consult that I have here. So you can find information about this at Treat Lyme. Basically, what I do is I'm able to visit with you by phone or by Skype video. And I get to ask a bunch of questions. You get to ask me questions, and I can come up with an opinion about what I think is going on with you, what the diagnosis might be. And I can even recommend treatment ideas, including herbs or prescriptions. Okay. Now, because I don't get to examine you, there is some limitation to these visits. The first thing is I can't prescribe anything. The second limitation is I can't order any tests for you. I do write a visit note, though, that I send to you and you can share with your physician so that if you happen to need some prescriptions or tests ordered, you could work it out with them to do that, okay? So in terms of how do you set that up? Well, first of all, I would read through this whole page. I talk through the ins and outs There is a disclaimer form that you'll need to sign that says you acknowledge that you know that I'm not going to be able to prescribe, and that a visit with me over the phone is not a direct substitute for visiting with a physician directly, okay? If you want to proceed with setting it up, there's two ways to do it. You can actually call Christine, my receptionist, at this 1-800 number here, or you can email her, and she'll be glad to talk with you about how you set that appointment up and the length of time. If it's going to be to develop a full treatment for you, I would suggest a 1-hour visit. If it's to answer a few specific questions, we could possibly do that in half an hour. But you can do that by communicating with Christine about that. Okay? All right. To take a look at there then. Okay? All right. So let's see here. I think I'm going to call it for tonight, guys. It's guys and ladies. It's about 6:27 right now, and I've got two Basenjis that are starting to look at me like, am I ever going to leave here? They need to go on their nighttime walk. And I need to end my day, too. I've actually had a long day here working, being in this webinar with you, but also treating patients today as well, too. So tomorrow morning, keep a lookout in your email somewhere between 6 and 6:30 a.m. in the morning, Pacific Standard Time, Seattle time. I will be sending out an email with information about how do you get access to the recording. If you happen to miss that email, you can find that recording on my Treat Lyme site. You can also find the recording on my homepage of my supplement store at treatlyme.com. And you can find that also on my YouTube page as well, too. So there's various ways that you can go ahead and find that recording tomorrow morning. Also, feel free to sign up for next week's webinar. We have 2 more this month, and then I'll take a 1-week break again. Although this time, I'm not heading down to Florida. I'll be staying in sunny Seattle. So anyhow, it's been good visiting with you tonight. I hope you got a lot of good information. In a second here, I'm going to send you back over as we close out. For those of you that are still here, I'm going to send you over to Treat Lyme, the Lyme disease information site. I'm going to take you to the page where you can subscribe. And I would appreciate if you would subscribe. When you subscribe to get all that great information, you're also supporting me and my abilities to do these webinars and keep all this going. Okay? All right. Good night, everyone, and have a good evening.